Hey, it's Hammer Time!
On the final episode for this year, 2019, of Hammer Time, we have two terrific guests. Jennifer Carusetta of the Health System Alliance of Arizona and the best economist in the state of Arizona, Jim Rounds. Welcome to the show.
Thank you.
Before we dig into the report, I'd like to, Jennifer, just give you the opportunity to talk a little bit about the group that you represent.
Sure. So I am the executive director of the Health System Alliance of Arizona. We are an advocacy organization representing the interests of large hospital systems across Arizona. My members include Banner Health, Dignity Health, Honor, Tenet Healthcare, which we recognize in Arizona as Abrazo and Carondelet. And we, within the last couple of years, have also added Northern Arizona Healthcare.
So the representation is even broader, is statewide, which is great. Mm-hmm. Now, Jennifer, I believe you asked Jim to really look into the economic impact of the healthcare industry. You know, in addition to keeping us well and alive, and that's a pretty important mission. There's also a jobs component, and we like at the Arizona Chamber to talk about that. The economic impact here is massive, and I saw a big round number, if you will.
That's right.
I hate punning, but I had to. Can you maybe talk a little bit about the report, and we'll go from there?
Absolutely. So, and I think you hit the nail on the head. When we think about hospitals, when we think about healthcare in Arizona, we think about the care that's provided to patients in physicians' offices, in our hospital facilities. But the story we're not telling enough is the economic impact that hospitals have in Arizona. And in fact, hospitals in Arizona are a powerhouse. And so we like to say that we keep people healthy physically, but we're also keeping the economy healthy.
And across the state.
Absolutely.
Jim, what'd you find?
Well, this was really interesting, and we've done probably a couple of hundred economic impact studies, but I really enjoyed this one because it was an industry that really wasn't included in the economic development discussion as much as it should have been in the past. And so we analyzed the numbers at the hospitals and found massive economic impacts, 30 billion, which is essentially equivalent to a GDP type figure for a project, nearly 200,000 jobs represented, about $800,000 in state tax collections, and that's just the tip of the iceberg.
And from reading your report, this when you add up all the jobs related to hospital and healthcare, is it correct that it could be the number one industry in terms of jobs?
It is. Now, real estate, single-family construction is still considered that, but that's really not a base sector industry. This is an economic driver, so I believe this is the number one industry in terms of size, but it's also high wage. And you have the hospital...
I saw 90,000 plus for people directly related to hospitals.
That's right. And then you have all the spin-off jobs that you typically see, but what is missed in these types of studies all the time, especially related to hospitals, are what's off campus or what is on campus but not in the tower. And so, for example, if you go in for surgery, you may have to do some testing on the site, but it's not at the hospital or maybe down the road a quarter of a mile. Those aren't captured in the statistics, but it's part of the analysis, and that could add a pretty significant percentage to the impact. So even though it was a big number, as you noted, it's really bigger than that.
Now, I don't know exactly what the term is, but sometimes you hear externalities to capture negative things that aren't necessarily captured in economic development in some different industries. This is a case, though, where the externalities would be positive in terms of quality of life. Is there a way to measure that, or for how do we think about that when communities have access to world-class healthcare? I mean, everyone who moves into a community wants to make sure that there's a way for them to get treated. And I'll just say, for me personally, my parents are going through this right now where they're going to move, and this is a win for the state, they're going to be in Arizona full time because of the healthcare system. And they don't have that level of access to excellence when they spend half or so of the year across the country.
I think what's great about Arizona is that, and even speaking from a personal perspective, we've had some healthcare issues in our family, and it's driving a half an hour to get to the physician where other people in the waiting room flew in. Those types of things exist, and it does help with economic development and recruitment, and it's really important in the rural parts of the state because you might have retirees, tourism, and while the hospital impact might not be as big individually, it's a bigger percentage of the economy. So there's all these additional things that roll together. Again, the tourism, the construction, this is a very impressive industry.
Yeah, no, I know when I needed my brain fixed, I wasn't necessarily saying, well, is this an economically, how do we measure this economically? I'll say I was just thankful that we had that level of excellence here in our state. But Jennifer, we all want this sector to grow and to continue to make people healthier and to literally keep people alive. But what are some of the challenges that the industry faces today?
I think you've brought up an important point because we're already seeing this mass migration to Arizona. And what we know about the population that's moving here is they're baby boomers and older, which means they're going to require more care in higher acuity settings and more points of care. So as an industry, we're spending a lot of time right now thinking, how do we meet the needs of the population today? How are we going to continue to meet them 10 years from now while still driving innovation, while still driving quality? And we've had long discussions about, what are the biggest challenges that we face in having those discussions and finding solutions around them. The reality is that during the recession, our policymakers had to make a lot of really hard decisions, including amongst those hard decisions was the decision to reduce provider rates by 15% across the board. In addition to that, they eliminated the inflation factor from statute, which adjusts hospital reimbursement to keep track with medical inflation. So while medical costs have gone up, the reimbursement we receive from our biggest payer, Access, our Medicaid program, has remained flat. And on average, right now, hospitals in Arizona are receiving about 71 cents on the dollar for their Medicaid volume. And again, that's significant when you talk about the largest payer for patients in Arizona.
How could we fix that? And my understanding is that we want to figure out a way that we're appropriately maximizing the dollars that are allocated on the federal level to our state. We know other states can be aggressive. And my understanding is if we do this in the right way, it could actually take some pressure off of our general fund, which would allow resources for other core state activities.
Well, and I think in talking with my members, one of the things that's always been important to us is to act as partners with our policymakers and to come up with sustainable solutions to problems, to also bring them problems and solutions before we reach a crisis point. We are lucky right now because we see the population boom coming. We know we have a number of physicians that are aging out of the workforce right now. So our intent in starting this discussion was, how do we get in front of the problem? So we engaged with Access a little over a year ago and said, can we develop a model where we can begin to address the shortfall in Medicaid reimbursement without actually touching the general fund? And indeed, that's what we've been able to do. So we would like to create a hospital assessment on outpatient services that would allow us to leverage and maximize our federal dollars, bring those dollars back into the state and into our economy, and begin the process of addressing the shortfall in our Medicaid reimbursement.
Now, we love when people come to Arizona from other states and other countries. We are the fastest growing metropolitan area in the region. What we don't love so much is when some of the policies from other states migrate here. And my understanding is that there could be an effort on 2020 from some California-based interests to fool around with some of the elements critical to having a healthy healthcare sector in the state. Can you talk a little bit about that, Jennifer?
Absolutely. So we have seen language, it's called the Healthcare Rising Initiative, and it does several things. But most concerning for my membership is it mandates a 20% employee pay increase over a 3-year period. And the important thing that I think nobody's talking about is the first 10% of that takes place within just over a month of the measure passing on the ballot, assuming that they qualified and did actually get the votes to pass.
Wow.
That is catastrophic for the hospital industry in Arizona that already is dealing with and trying to think about the challenges we have coming in the population boom and everything else. It would be a game changer for our industry.
Jim, would love any of your thoughts.
I agree, and we've worked together on different initiatives in the past and economic priorities and programs, and in this case, the reason that I think that we need to put more emphasis on the industry and also focus on this particular initiative is that I'm starting to see overlap between different efforts. And then you know that we're going in the right direction. So we've been very positive about where the economy has been going the last few years, and we've been growing very rapidly. And now we're on this cusp of growing high wage jobs, and this is where industries like healthcare help. But when we deal with these outside initiatives, we're talking about that percent increase in wages in an industry that has $90,000 plus average wages. That isn't the right policy. So it's not necessarily the concept that they're looking at that's bad all the time. It's sometimes how it's implemented. In this case, I can't really see anything positive about it at all, and it will have negative economic consequences.
Well, this is one where it's pretty fair to say, as a general rule, the Arizona Chamber furiously resists these California-grown efforts to change our policy, and for people who aren't going to live in our state and have to deal with the consequences. Because from our vantage point, that type of initiative goes far beyond the hospital and healthcare sector. That would affect employer rates. That would affect individuals. And what happens if hospitals in certain rural communities can't make the math work? The best case scenario is that they reduce operations. The worst case scenario is they're gone. And I don't think we want to say, for someone outside of Maricopa County, your solution is just get in a car and drive 2 hours or take an Uber. That's not a good one. But let's we're right around Christmas and Hanukkah and the New Year, so let's think happy thoughts. The upside, where's the industry going? This seems to be the numbers seem to be very positive in terms of the overall growth of employment and economic impact, and just the life-saving treatment. So I'll start with you, Jennifer. Just some good thoughts as we go into 2020.
I am thrilled. I'm thrilled to have the opportunity to work with Jim, thrilled to have the opportunity to work at the Chamber to tell the story. I mean, this is, I think, again, people think about healthcare, they think of physicians' offices, they think of hospitals. They do not think about an economic powerhouse. And I'm really proud of the work we're doing in healthcare in Arizona. I think it's the best you can get in the world. But I'm also very proud that we are also able to help support the economy. And I am so excited to be able to launch this economic development package to the legislature in 2020. I mean, we're talking about infusing $1 billion back into the Arizona economy. So we're already world class. We're already doing great things. Just imagine what we could do with that investment.
We're just going to keep going in this direction.
Absolutely.
Jim, best economist in the state, take us home.
I used to criticize people for saying fork in the road, but it's a fork in the road in terms of opportunity. I congratulate the governor and the legislature the past several years for taking us out of a terrible downturn and setting up this really strong economic foundation. And now we're talking about strategic investments. We're talking about return on investment with public policy projects, things that other states don't look at. And if we make some wise decisions now, we don't just throw money at problems, but we research it properly. We actually try to bring in some business principles into how we run government. I think we're going to have the best economic expansion that we've ever had in the 2020s, and this legacy is going to be long-lasting. But that also means that if we do the wrong policies, we can mess that opportunity up. So I'm very optimistic more than ever about the state, but there's more to be done. There's always more to be done.
Thank you both for ending the show and 2019 Hammer Time on a positive note. Wishing everyone Merry Christmas, Happy Hanukkah, and all the best in 2020.